I've been working with Design That Matters, which is a nonprofit that focuses on medical devices for low resource settings, in order to create a face shield that would work well for healthcare providers. COVID-19 is making all settings into low resource settings, and people are running out of supplies. And, ideally we would have been prepared as a country and as a globe for a pandemic like this, and we would have had, kind of turnkey operations where we could keep the existing supplies that we already know and love in stock. But unfortunately, there are gaps. And so in this case, this enables the world of people out there with 3D printers, even in their home or at school or at work, to help plug that gap. Current commercial face shields are usually often a piece of foam and then the clear piece of plastic and a bit of an elastic band. And the thought is that you throw it away every time you see a single patient. And because people are running out, a lot of those are starting to be reused, and they're really not made to be reused. So the idea with this design is to create something that can be wiped down according to CDC protocols, and that can be reused so that healthcare providers continue to have a face shield to protect themselves while they're providing this necessary care. This is a completely open source design, so anyone can download it from the NIH website and print it tomorrow. So if you do have access to a 3D printer, you can do that. In terms of finding where should they go, some of the recommendations are to look in your local area to see if any other people are doing the same initiative and sort of join together to coordinate. And in particular, there's a website called Get Us PPE, which essentially allows people around the US to post need. In some cases, people may know of 3D print resources that are locked up, so at a business setting or a library or a school. And in most states, printing or creating PPE is considered an essential activity. And so it is possible, and we've created a bunch of tools to allow people to make the case for why they should be able to access those resources and start fabricating today. So far, we're seeing people across the United States and even across the world start to print these. So we've seen folks at Bates College in Maine, we've seen people in Illinois, we've seen people certainly in Washington and Seattle, as well as New York and Boston. So it's exciting to see this start to spread. And we've also had some connections from Haiti and Kenya who are firing up their 3D printers as well. In addition to spreading this design as a 3D printed, locally fabricated option, we're working with manufacturers who want to scale this as well. So if any of you hear of someone who wants to scale the design, we've also created a working group for that. I hope that we're able to stop the PPE gap in terms of face shields in many places around the world, certainly. But in addition, I hope that this can be an example of a way to develop medical devices in an open source way that can benefit communities more broadly. So I hope that lasts beyond this particular pandemic.